is Dr. Manisha. I am working in Lupin in Medical Affairs Division. On behalf of my team, I welcome you all. And we'll be having a brief discussion with our doctor today joining, Dr. Shahin Mujjawar, who is currently practicing in Maharashtra, the psychiatric practice. And here she will be giving us very important, valuable advice for the people who are affected with some psychiatric elements. Welcome, ma'am.
Thank you so much, Anisha.
Yes, thank you, ma'am. Thanks for joining.
Uh,
Uh, so today, the program has been arranged to make the patients of PCOS to be aware of having there are certain psychiatric elements which are very deleterious and very detrimental for them to live in a routine life. So here, I will be giving us some introduction part. Like if you say that PCOS is becoming very common among the women, particularly in adults and young middle-aged women. And there is also increasing evidence in the literature saying that PCOS increases the risk of psychiatric disorders also. So, what are your commonly observed psychiatric ailments in women with PCOS?
Mainly, we see generalized anxiety disorder and major depressive disorder in our practice because PCOS is having the symptoms of obesity, then male type baldness, which women are very concerned about. Then there's hirsutism, like there are hair everywhere around the body. Means body shaming is there. Then they are disturbed due to hormonal changes which go within the body, due to like disturbed menstrual cycles, irregular menstrual cycles, and all these things. Then this all lead to like decreased self confidence and disturbed body image, as it is. Even people around notice it, and they try and de- demoralize these people with then infertility is one more thing which goes along with PCOS. So people are generally disturbed because of it, and mainly we see major depressive disorder and generalized anxiety disorder in cases where uh, patients generally are unable to express themselves due to social social stigma. Anything else?
Yes, thank you, ma'am. Yeah. So, yeah, as you said, it is because of multiple factors involved in this disorder.
Yes.
Yeah. So it is very serious condition. As being a female, we can actually easily relate how these patients might be feeling, because it is very sensitive area to think of, and they also consider themselves as something which is wrong with them, and it directly impact their psychiatric health.
Right.
That's absolutely true. And then I would also like to understand from your end, ma'am. Second. There is other factor to this is that why it is important to prioritize the mental health in women with PCOS, because they might be affected with psychiatric illness. Do you feel that it is important for them to consider the psychiatric elements as a major disorder for them? Does it also impact their other social status and standings, which will affect their long-term life?
See, psychiatric illnesses, like for example, if they are depressed, they tend to be negative about everything and anything. So, in case of in case the PCOS is treatable, for example, having good lifestyle changes, exercise, regular diet, balanced diet, and everything, they won't go towards it. They neglect everything then. So, if the depression part is being treated, they'll have a positive approach towards everything, and plus the anxiety might reduce when they get to know that sometimes the feeling the patients get is only I am suffering from this. They don't understand that there are many other people suffer, other women suffering from the same disease. So if we give them the um, feedback, like okay, you can do it, and some regular exercises and diet control, they might be able to have good ovulation cycle and normal menstrual cycle, and even the body shaming, the part which they are more affected by, and that might get reduced.
So what?
So it's actually basically necessary for every gynec to refer. It would be better if they refer to psychiatric at least for counseling, or if needed treated by psychiatrist.
Right.
But again, the major part comes like choosing the antidepressants if needed, because most of the antidepressants they tend to have side effects of weight gain. So we as psychiatrists are then, our responsibility is to choose wisely and give them those antidepressants which might not reduce add to the agony.
Right. Absolutely. You are absolutely right. So thank you for sharing this important insight, which I feel like that is also important. Like managing the patient is important, but managing them without making them having some additional burden of those medication, that is also very
Right.
important. Yes, yes. Ma'am, we would also like to understand from like patient perspective how generally, psychiatrists treat such patients, or what precautions or what other part, non-medication related managing part to the patient, how it is handled in general practice.
Means without antidepressants, you mean to say, or any
Yes.
medicines from our side,
Psychiatric
right?
counseling. Yeah, yeah, yeah. What is the
Yeah,
important?
yeah. We do counseling because see, these patients they have been treated by many doctors in first place, and they keep going to various gynecologists because they feel that probably the diagnosis is not proper. So
Mm-hmm.
they'll keep shifting from gynac to gynac, and then some gynacs they may refer to us for counseling when they sense there is some need for psychiatric interference.
Right.
So when we see such patients, then we need to tell them, and counseling is the better way. Like making them understand that this is a disease, okay, and it can be treated with their support. It's not only the gynac or a psychiatrist who will be help treating them. Their intervention is also as important as ours. So it can
Right.
be done like being a team in this case,
Mm. Mm.
because again, when they take treatment for PCOS, the again treatment part is again the hormones,
Mm. Mm.
or which they give to balance the PCOS, the ovulation cycle. So that contains that gives side effects. So we as a team, like gynac, psychiatrist, and the patient together, we can help the patient. The patient should be
Okay.
taken in confidence.
Right. Right. Rightly
That
said. Rightly said, ma'am. At the end of this session, while before winding up this session, I would like to ask you what is your advice or recommendations about the this condition, women with PCOS, who are also struggling with some depression or anxiety.
See, basically, this is a stressful situation. So, in order to reduce the stress which they get due to either hormonal imbalance or the society pressure from the society, so they need to do some changes in their lifestyle. For example, acquire like regular exercises and de-stress themselves by doing meditation or yoga, which is highly recommended, because and plus lifestyle changes like regular exercises and diet, because there are studies showing that even if the weight doesn't reduce in case of PCOS, they can still have an good ovulation, and the infertility part can be handled skillfully
Right.
and with less trouble going to IVF or something like that.
Okay, so thank you, ma'am. Thank you for this important,
I
valuable.
hope I have been giving the right advice and been useful for you. Thank you.
Yes, 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 yes. So thank you, ma'am. Thank you very much for coming here and taking time from your busy practice also and sharing this information for us. That will be really helpful for across, group of patients as well as psychiatric people. Thank you.
Thank you for having me. Thanks.